Hello, this is Tracy Wallace, Director of Training at the California Family Health Council, and I am pleased to be your presenter for this learning session. This training was developed by the California Family Health Council as part of the California Primary Care Association's Patient-Centered Health Home Initiative. CPCA's Patient-Centered Health Home Initiative is a statewide program to support community clinics and health centers in patient-centered practice transformation. More information on the Patient-Centered Health Home Initiative can be found at cpca.org. Today's learning session will be exploring the topic of improving the patient experience. By the end of this session, you will be able to list 4 components of a positive patient experience and identify 2 steps that can be taken immediately in your practice to improve the patient experience. Researchers believe that close to 90% of consumers choose healthcare based on word of mouth. Given these findings, we believe it is important for you and your staff to evaluate what kind of services you are providing your patients. Are they patient-friendly? Are they the services that you yourself would like to be receiving? Are there room and areas for improvement in the ways in which the services are being provided? This learning session will explore this and much more. What we do know is that a satisfied patient tells 3 to 5 people, and an unhappy person tells 11 to 20 people. Probably with the use of technology and such consumer sites as Yelp and Angie's List, these numbers are growing exponentially in terms of the number of people being reached with information about happy patient experiences and the numbers of people being reached with information and experiences and customer reviews regarding unpleasant patient experiences. When we talk about the patient experience, we can really call this customer service. Customer service is a concept that's been studied and researched for a very long time. Specifically around services being provided in a healthcare facility, this is an area of great interest to many involved in not only the Patient-Centered Health Home Initiative, but all those moving forward with healthcare reform, knowing that patients will have many, many choices moving forward. And if you want patients to choose your healthcare facility for the services that they need, then paying attention to the way you provide customer service is now an important aspect of the care given to your patient. Customer service is really moving out of the realm of retail providers into the realm of healthcare providers, and not just how the care is given, but how the patients are being treated when they get that care. Studies indicate that almost 3/4 of patients who do not return to a health facility state dissatisfaction with how they were treated as a primary reason for not returning. A patient-centered care approach to providing health care is what all providers should be striving for. This is about providing the care that the patient needs for the best possible outcomes and individualizing that care for that particular patient's needs. Part of a patient-centered care approach includes the patient experience. The positive patient experience looks at the following elements: the clinic environment or the healthcare setting environment, the people skills of the staff working in that environment, the medical expertise of the staff responsible for providing care in that environment, the systems set up in that particular healthcare setting, the amenities available to patients as they walk into that healthcare setting, and the affordability of the services that are provided. I'm going to repeat this message several times throughout this learning session because it is a simple one, but it is a very, very important one. The message really is, do not underestimate what a difference a small gesture can make in helping your patients feel welcome. In providing a positive patient experience, some of the smallest, most nuanced gestures really make a lasting impact on a patient, assuring that they will want to return again and again for care provided by you and your team. The welcome mat is a good analogy for this. Are there small steps, not to preclude large steps that should always be taken in terms of providing the best possible care and using the best possible systems, but are there small steps in addition that can be taken to make every patient feel welcome and feel special and want to return? We're going to first look at the environment. And the environment includes not just the space in which care is given, but is the space where care is given easily accessible? Is it space that makes a patient feel safe? Is it space that is clean? Is it space that is welcoming, inclusive of the diversity of patients which you serve, from young to old, from different demographics and different socioeconomic backgrounds, from patients who may be partnered and unpartnered? Think about the diversity in the patient population you serve and think about your environment. Does it reflect who they are and what their needs are and what might be appealing to them? We're going to look a little bit closer at the environment in the following slides, but first I want to make sure the people in the environment are really setting the tone, because you could have the most inclusive, clean, bright, cheery, safe, accessible space, but if the people providing the care in that space are not reflecting a commitment to a positive patient experience, then you may have invested for nothing. People skills. People skills, this list of descriptive words could look different depending on who's writing it. These are just a few examples that we wanted to present in terms of a model of positive patient experiences. We ask you to think about, is your staff friendly? Are they responsive? Are they helpful? Are they respectful? What does a staff member do who doesn't know the answer to a patient's question? Do they let the patient know they're going to try to find an answer? Do they seek the answer out themselves? Are they resourceful enough to get the patient the care that they need or the referral that they need? Or do they let that patient feel that their concern was not addressed? Are they respectful? Is your staff approaching each and every patient as if they matter? And if there's any barriers to being able to provide the utmost respect to any patient, is that staff person encouraged to step out of the exam room or step out of the space that they're in and identify another staff member who could more respectfully provide the care that that patient so deserves? Is staff encouraged to understand where their limits are with providing responsive care? Are there language limitations that your staff may not speak a language spoken by many of your patients? So do you have a system in place for staff to be able to identify who can then speak to that patient in a different language? Is staff as friendly and as open and as courteous as they possibly can be? How can you help your team improve their people skills? Are there trainings? Are there staff development opportunities where staff is being assessed and people skills are being discussed and areas of growth are being looked at? I really encourage you to think about the people skills of your team. Think about who might have some outstanding people skills and recognize those skills, acknowledge them publicly, praise the staff, and ask them to continue being a role model for other staff who may not be demonstrating the qualities at least consistently or perhaps at the level at which you believe they should be. People skills cannot be underestimated. Their importance in providing the positive patient experience is critical. Is there a customer service policy or a patient experience policy that all members of your team are aware of? Is it in writing? Is it part of a new hire orientation so that anybody joining your team is aware of your commitment to creating a positive patient experience? Get everyone on board, provide them with training, written customer service policies, and public acknowledgement. Little incentives, gift cards, employee of the month, the premier parking spot, a few extra hours of work time that's comped. All of those are steps in the right direction in terms of recognizing and acknowledging the effort being made by your staff to provide positive patient experiences. It's not enough to have only a few staff members buy in or to have supervisors buy in, but not the staff that they supervise, and certainly vice versa. If anybody is supervising staff and they're not being a role model for positive patient experience, it's quite a stretch to think that the staff they supervise is going to then be providing that quality care. So it's critical that all hands are on deck. Everybody must be on board with this plan, from administrative staff to operations staff to the frontline staff providing the patient care. If there's any areas where you see there's a need for development, I encourage you, training, written agreements, staff development, bring in videos, find online modules. Make time during regular staff meetings to address this issue of the positive patient experience, and do this at all levels of the healthcare setting staff. Again, with the top level administrators, with folks responsible for operations, and of course, those coming in direct contact with your patients. Medical expertise is part of providing a positive patient experience. Does your staff have excellent knowledge and exam skills? Are they using up-to-date treatments and technology? You certainly don't want to have a care team that isn't using the best possible medicine and technology available. Don't be left behind. We know that patients will have choices of providers, more choices and more freedom to exercise those choices than they've ever had with healthcare reform coming into play. So your staff and their skills and their knowledge in the use of the most up-to-date treatments and technology is going to be critical. when providing a positive patient experience and taking the steps you want to take so that that patient returns again and again and tells their friend and their family member that it's your health care facility that they should be going to for care. This next slide looks at systems. And I think at first glance, it can feel a little overwhelming if you are one of those facilities that knows you need to improve upon your systems. So I will say from the get-go, it may be very unrealistic to try to improve all of these system areas at once. Prioritize. Where can you begin? Where do you think you will have the chances of greatest success? Start there and build on that. Changing systems will ultimately impact the patient experience, and it will certainly do a lot to boost the morale of your healthcare team if they see a willingness to invest in improving upon systems. The first system that we look at are phones. Are phones answered quickly? And is the staff that's answering the phones responsive? Responsive and friendly and resourceful. Let's not forget those people skills. Are they helpful? Are they respectful? Appointments. What is the wait time like? Is it short? Could it be shorter? Is there a way to improve upon the wait time that patients are experiencing? Is there efficient use of the wait time that goes on? Efficient use of how the appointment system is set up? Looking at technology and its role in appointments is really critical. If your staff is not familiar with all the options available for using technology for appointment scheduling, then it's crucial that they become familiar and it becomes a part of how patient care is provided. Operationalizing, using technology to operationalize your appointment systems will ultimately have a great impact on the patient experience. The results. Your patient has just come in for test results. They want to know how their cholesterol levels are. They've been working hard to change their diet, to exercise more, and it's critical for them to see some success in order to keep going. They're not feeling all that motivated anymore. That quick turnaround time on their results may make a very big difference in that patient's willingness to continue with their regimen. Delivered quickly, easy to get. Are you using technology to deliver results? And if not, are you using the best possible mechanism for that patient? Again, you're providing patient-centered care. Have you asked that individual patient, how would you like us to provide you with your results? Not all patients will answer with technology as their first choice for the place in which they go to get their results. What are you doing to address common patient complaints like long wait times? The next slide explores some strategies. Are you reducing the time from calling for an appointment to actually being seen? Again, this has to do with how your scheduling is organized and what kind of systems are in place so that appointment times can be as realistic as possible. Reduce the time someone sits in the waiting room to be seen. And use the time a patient sits in the waiting room strategically. If a patient is in the waiting room and is so distracted in a good way by what's being made available, by what's offered in the way of videos or tablets or computer terminals or even live health presentations, then they're not going to be focused on how much time they're actually sitting there. There are some extremely innovative ways to use the waiting room to educate patients. I've heard of folks having staff come in every hour on the hour to do a 5-minute health presentation. I've heard of healthcare facilities providing patients with tablets that they can use while sitting in a chair in the waiting room to access health education materials. And for quite some time now, we've seen the use of videos in waiting rooms. But are they videos that are going to benefit your patient's health? Or are they just telenovelas that are going to not do anything in terms of providing information or supporting your patient in making healthy choices and having a healthy lifestyle? Amenities. Amenities. I like this list. I feel that this list could go on, and depending on your facility, this list might look very different. This is just an example of what amenities could be made available. Maybe some of these already are, and we certainly applaud you for that. Can you add some others? Is your clinic environment, is your healthcare setting family friendly? Are there toys or books available for younger patients or young children coming in and accompanying the adult patient? Are magazines up to date? There's nothing like picking up a good housekeeping from 2002 when your patient population is all male and the year is 2013. So make sure that reading material that's for pleasure and entertainment reflects the diversity of your patient population and will make the experience in the waiting room a more enjoyable one for them. In addition to magazines that are for entertainment, are there health education materials available in the waiting room that reflect the diversity of the population you serve? Is it inclusive of languages being spoken by your population? And is the material being presented relevant to the types of visits people are coming in for, the types of services they're looking to receive? Is it possible to have internet access in your waiting areas or in your exam rooms? Is Wi-Fi available? Can people with their smartphones and their tablets and their desktops still feel connected to the outside world while they're in your space? Water and snacks, things like samples and hand sanitizers and wipes go a long way in making the patient feel more comfortable and more likely to want to come back. Affordability. We know that more and more patients will be enrolled in health insurance, and this is a great thing. There will be patients who are still paying with co-pays and other fees, and we need to continue to keep in mind services that we might be able to offer for free or at very low cost. Are there screenings that we could provide for our patients for free? Are there bus tokens or other amenities we can provide to our patients to make the experience one that is less costly? Is there an enrollment specialist available to help the patient with applying for public assistance? Or are referrals available to such a specialist? It may not be that you have the space or the opportunity or the resources to bring an enrollment specialist on board, but do you know where they are in your community or in your facility? If you're part of a large hospital that may have this assistance available, can you have the patient pick up the phone from your area and connect with somebody in the enrollment department so that there's a real person they're connecting with, assuring the greater chances that they're actually going to follow through with making an appointment and keeping the appointment and getting enrolled in the type of public assistance that they are actually eligible for. Patient-centered care. Again, we've seen this slide before. It's important to review. These components are what make up the positive patient experience when we are striving to provide patient-centered care. The clinic environment or the healthcare setting environment, the people skills of the staff working in that environment, their medical expertise. Are they as up-to-date as they possibly can? Are they using the latest and greatest technology and medicine? Are your systems working as efficiently as they can be? Are you using technology to your advantage? What amenities can be brought in to make your patients more comfortable? And in fact, ultimately make your staff more comfortable. If you're offering amenities in the waiting room, is there an opportunity to offer a few amenities in the break room? By keeping your staff happy and their morale up, that will certainly translate into a more positive experience for the patient. They're receiving care from somebody who's happy at their job. That person is likely then to demonstrate better people skills. Affordability, we touched on that already. Where are there areas where you can provide free screenings or some support to the patient who may need travel expenses covered, or more importantly, need to connect with somebody who can help enroll them in the health insurance programs that they are eligible for. Here are a few questions to consider. I've presented a lot of aspects of what positive patient care looks like, and for some of you who are new to this concept or just getting your feet wet, it might feel overwhelming. I really invite you to think about the things that you are already doing well. Start there. What is working? And talk about that with one another, and acknowledge what's working. And praise those people who are doing the right thing, who are practicing great people skills, who are doing their best to make sure patients are notified of possible wait times, who are bringing forth new and innovative ideas about health education materials and information that could be presented in the waiting room. So what are you doing well already, and who on your team is doing it well? What can you change quickly? So this is where taking some small steps in these areas of positive patient care, whether it's changing something in the environment, changing an amenity that's being offered, getting some more training for your medical staff, or thinking about amenities that are offered. What will take more time? These are all the areas that in your strategic planning of how to provide positive patient experiences, you want to set out a plan, and you want to think about who needs to get involved in that plan to really implement it. Is it the frontline staff? Is it the admin staff? Does this need to be brought to the staff who's involved in operationalizing? Is it the role of the IT staff to make the changes to the systems so that the appointment scheduling can run more smoothly? Who needs to be involved? How much time will it take? How much money will it cost? What are your resources available to this? So think about this in the strategic planning. What do you want your healthcare facility to look like? What is the ultimate vision? Can you sit down with members of the team and do a visioning type activity? If you had endless resources, what would you like to be providing here as in an effort to give the patient the most positive experience that they can? The positive patient experience. We're going to look at a few aspects of the positive patient experience. The experience, we want it to be culturally sensitive. We want it to be linguistically appropriate, patient determined, and emotionally responsive. We'll explore each of these topics a little more closely. What does it mean to be culturally sensitive? I will certainly read you the definition that we want to share, but I would encourage you to ask your staff, what does that mean to them? Each person you ask may have their own definition. It would be important that the entire team is in agreement on what it means to provide culturally sensitive care. To be culturally sensitive takes a lifelong commitment to self-reflection for the purpose of developing mutually beneficial and respectful partnerships with diverse individuals, groups, and communities. So this idea of cultural sensitivity is a dynamic idea. It will certainly keep evolving as the population you serve changes. As you serve people coming in from other parts of the world or from a different age group or a different socioeconomic background or a different sexual orientation that you have served in the past, how will your staff respond? What will you do to be respectful, to be sensitive, to be caring about where each and every one of your patients is coming from? This is putting into practice cultural sensitivity. Linguistically appropriate. Patient-centered care needs to be linguistically appropriate. That means communicating on the patient's level. It means providing trained medical interpreters, making sure staff members are clear on how to access language lines if interpreters are not available. And it means never using family or friends for interpreting. The use of family or friends can really lead to inaccurate, inappropriate, uncomfortable situations. So we want to discourage that, and we want to encourage the other 3 bullet points mentioned in this slide. Communicating on a patient's level should be considered critical, and a positive patient experience needs to start with how that patient is communicated with. Are they being communicated with on a level that they can understand? So is information being explained using easy to understand, simple language? We know in terms of patient literacy levels, it is one of the #1 indicators of health outcomes. Does the patient come into your healthcare facility with a low literacy level? Addressing their needs becomes a very important part of having positive patient outcomes with that patient. Patient-centered care means being patient-determined. The patient's greatest concerns are addressed first. Concerns are clarified and a plan is put into place. When a patient comes in with a list of concerns, it's okay for you to take a moment and breathe and realize you have an important role in helping that patient clarify what is the most important concern and addressing that one first. This is not necessarily an easy practice, but with time and experience, it does get easier. If it's an area where staff can use some support, make sure they know where to get it. Make sure staff has access to their supervisors and to training when they need it in terms of helping patients cope with a long list of concerns they may be coming in with. The role of guiding the patient into clarifying what is their most important concern is key to providing a positive patient experience. Patient-centered care means care is patient-determined. If you're not clear on what the patient's agenda is, ask. Staff should be encouraged at all times to use communication techniques that will open up communication as opposed to shutting down. Is active listening being applied every time staff has a patient encounter? So paraphrasing, parroting, reflecting feelings, and asking open-ended questions will help the whole team provide better patient care, because it is helpful for the team then to understand what the patient needs, to get clear on what their agenda is, because it isn't about the agenda of the person providing the care. Patient-centered care is about the agenda of the patient. If you ask an open-ended question and the patient gives you a response and you are still not clear, then that's going to require that you ask again. And even better, ask the same question but in another way until you can get to a mutual understanding with the patient. Some examples of patient-determined questions are as follows. Asking a patient, what brings you in today? What do you think is going on? What is the most important thing we can do for you today? By asking these questions, again, you're letting the patient set the agenda, and you are providing the patient with the sense of being in control of the care that they are getting and having a positive patient interaction with the staff that's providing the care. Patient-centered care includes being emotionally responsive, acknowledge and validate a patient's feelings. We'll use that example of the long wait times. When a patient is finally brought into an exam room, does staff acknowledge that the patient is showing visible signs of frustration, of being upset, of being angry? Is staff looking for things like the nonverbal cues, facial expressions, and body language to tell them that this patient needs their feelings validated? It's not providing positive patient care if feelings aren't validated, and avoid getting defensive. So staff doesn't need to be defensive. Again, this is about the patient's experience and the patient having their feelings validated. Staff may feel like getting defensive. They may feel the need to defend themselves or in some way to respond with the same kind of anger or frustration to the patient that they are being confronted with. But this is where staff development and training and support from supervisors comes in to make sure that each member of the team knows they have a safe place away from that patient, away from that immediate moment of care they're providing, where they will be able to vent or to process or to discharge some of those feelings that have been brought up because of a patient's strong feelings about a certain interaction. So put into place a safety zone for your healthcare team members where they can have their feelings validated and acknowledged. But let them know it is not going to be appropriate to have those feelings in front of the patient. They're there to just support the patient and validate their feelings. Feedback is important. So this is how your patients can let you know how they're really feeling about the care they're receiving. How do you get this feedback? I'll ask you before I move on to the next slide to reflect on that a moment. What are you doing? Are you doing anything? If you're not, it's certainly time to consider this as part of your plan, your strategic plan for providing and improving the patient experience. How are you getting feedback from your patients? Here are some examples. Is there an anonymous suggestions box that could be placed either in a waiting room or in an exam room or in a lab room? Or could technology be used so that a survey sent or an online tool is used where patients can enter in their feedback regarding the experience they had? Customer satisfaction surveys work in the same way as the suggestion box, but they may or may not be anonymous. And again, you can use technology or provide a survey right there in the waiting room or in the exam room and capture that data right as the patient is there. Patient advisory groups. I like this one. I think it's underutilized and it's a very powerful tool. The patient advisory group can have many, many roles in shaping how care is delivered at your healthcare facility. But one role they can play is certainly to provide feedback on the care that they are receiving. Talk about what's working and encourage the advisory group to be innovative and think of ways to improve the way care is delivered, to be constructive. So it's not just an opportunity to vent and to complain, but then to problem solve. And a simple sign indicating the name, perhaps with a picture of a person on staff who's there to listen to patients regarding their experiences, a staff supervisor or manager who has within their job description the role of patient liaison or patient satisfaction coordinator, or whatever works in your healthcare setting. Maybe it's an individual, or maybe it's a duty where several people share the role and they rotate through being in the position to be available to patients who need to speak with somebody, need to connect with somebody regarding their experience. Anytime you can get feedback, it should really be seen as a gift. We like to say feedback is important and complaints are a gift. So feedback is wonderful when it tells you what you're doing right, where that patient has had a very positive experience, and the great stories they're going to share with their friends and family. But the complaints are even more useful. The complaints really provide you a place to work from in terms of what could be improved, where do we need to go from here, let's problem solve, let's think creatively, let's move in the direction of providing the best possible patient experience that we can. I would encourage you to not only think of mechanisms for getting feedback from patients, but from your own team members as well. Your team members may have very creative solutions for some of the problems that your patients are confronted with. But if no one's asking them for those solutions, they may not feel empowered to speak up. They may not feel it will make a difference. Well, what will it matter if I share this idea? Nobody's going to do anything about it anyway. Can you create some space in your staff meetings or in the time in which staff receive supervision that members of the team are asked for their suggestions or complaints or feedback regarding how care is delivered and what could be done to improve the patient experience? So as much as we want to hear from the patients, I encourage you, is there a way to include the staff in this conversation? Feedback is important. Those who complain are showing loyalty. It can tell you how to improve services and overall patient satisfaction. If the person was so unhappy with the services, it's possible they would not even bother complaining. The fact that they're speaking up shows a level of investment on their part, either because they want to care and come back, or because they have a thought of how things could go better, or because they are committed to seeing what's being done be done better. So listen to those patients who complain. Thank them. Acknowledge that they may, in fact, be showing loyalty. There are a wide range of tools available from simple to complex, for identifying areas for improvement and for implementing change where it is needed. Again, using technology can be critical in improving the patient experience, but simple things like current magazine subscriptions that reflect your patient population's interests, to having water available in your waiting rooms, to having friendly staff that work as a team who acknowledge a patient's feelings and validate them and are helpful and are respectful, are strategies you can begin to implement right away if you haven't already. In this final slide, I'd like to bring your attention to a few resources we have found to be really useful for those healthcare facilities interested in improving the patient experience. And I thank you very much for participating in this learning session, and certainly hope that you found it useful.